All right. So I am here with a very special guest, Mr. Larry Sanders. And yes, he is Bernard's brother, but he is actually quite experienced when it comes to the NHS. He is in UK, and we talk a lot about how Medicare for all, national Medicare for all, would be what we fight for, but a lot of people do feel like the NHS would be even better. So I thought, who better to talk to about the NHS than Mr. Larry Sanders, who you actually were the spokesperson for the UK Green Party in regards to healthcare. So thank you so much for joining me again. I always love speaking to you. So, first of all, just kind of on a more basic question, what do the people in the UK as a whole think of us Americans and our healthcare system?
Well, insofar as they think about it, most of what they hear is very worrying. And I want to tell you that the NHS and British health is not a utopia. But part of the problem, the structure is fine, the principles are fine, but to have a good health service, you have to have the staff, you have to have the money. And what you have when you have a right-wing government, as you frequently do in the UK, the health service suffers. It doesn't suffer as much as it would if it were privatized, and bits of it are being privatized. So when you ask me what people in this country, a large part of what people who are following it here is that there are, in fact, some of these terrible American companies that have done so much damage in the US are actually buying their way into the British system. So that's one thing that you hear about. But it'd be important to know that actually Americans pay per head about twice as much for healthcare as we do in the UK. All the key statistics about how long people live, how many children die before they're born, or in the early, the early weeks and months of their lives, uh, lives lost by women in childbirth and in pregnancy, all sorts of statistics that all governments keep. In fact, the US is pretty far down the list. And the UK is not great. There are countries ahead of the UK, but we're way ahead of the American results, and we do it at half the price. If we had the American money, the UK, the NHS would be a utopia.
Yeah, absolutely. And has since since its inception of the NHS, has it always been something that, you know, big money and the elite and the establishment has tried to take on?
I suppose the answer is yes and no. In the early stages after the Second World War, when the discussion became serious about a national health service, when the Labour government was elected, a left-wing Labour government was elected in 1945. It's interesting. I think for us, you and I, it would be very interesting to note that the polls that were taken in the United States and in Britain about having a national health service, a universal health service, were pretty similar. In both countries, a majority of people wanted it, something in the 60%, 65, 60%. There was not a lot of, I haven't studied it that closely, but basically the moral is that the people in favor of a universal health service, free health service, the numbers were very similar in the US and the UK. In the US, we had the horrible business of 1946 election in which the Republicans took control of Congress, and Truman, who was obviously not the most left-wing person in the world, was quite strongly in favor of a universal service, as had FDR, of course, been. So that turning point when the Labour government won a big victory and succeeded in starting an NHS against, and this is important, against the Conservative Party that voted against it dozens of times. against the medical profession at that stage, although now the medical profession is almost entirely in favor of it. Very few people who don't, doctors and nurses and whatnot, that don't like it. But at that point, it was different. So in the US, we had this misfortune of this really particularly nasty Republican Congress elected, which destroyed our chances. And if somebody has the stamina and to do it, they could figure out how much money and how many lives that particular vote in one particular nasty Congress has cost the people of America. So I don't know. I think I got a little lost there, but
no, it makes perfect sense. And what are your thoughts as far as right now? It seems like people like Pramila Jayapal, who wrote, the bill after Bernard, they're, now they're saying, well, it's great if we lower Medicare's age from 65 to 60. What are your thoughts as someone, with the NHS on that incrementalist approach?
Well, I mean, that's in the hands of political judgments at given times. There are times when it's sensible to make those kind of compromises. It makes in the principle of the way the service works, it makes no sense. The all these compromises that I've seen that have been put that are short of having a proper universal free service rely on using the current service. And somebody has said it's like putting extra money into a leaky bucket, or like water into a leaking bucket. It flows out, and it doesn't flow out into to good points. It goes into the people who are making the profits to start with. So most of those things, they may well be better for some people, and something that is better for some people is good. Saving people's lives in their measure, is not a bad thing. But the structure, anybody who says that a universal service is not the most efficient way is wrong. It is the most efficient way. It may be at a particular political moment, the right thing to do, but in terms of a general policy, the cheapest, most effective, most life-saving, the most decent thing is a universal service in which everybody gets the care that they need. That's the crucial bit. It's not based on your money. It's not based on how clever you are buying insurance or how lucky you are with an employer. It's based on the fact that you're a human being who has certain medical needs, and those needs ought to be met as well as that society can meet them at that time. And that is the bottom line. It also turns out to be much more efficient, because instead of having hundreds of billions going to insurance companies, it costs you about 20 cents a person to sign them up. It's a very easy to include somebody into a universal service. Almost all that stuff is unnecessary, wasteful, and in the end destructive. Yeah.
Right. Now, right now, President Biden has the ability to sign an executive order for 1881A to give all of us Medicare for all during a pandemic. But he has not listened to our requests, and he has stated literally he would veto Medicare for all. He also, when campaigning, said he would give a public option, which is, of course, breadcrumbs, but he has not even done that. Right now, we have over 50 million people uninsured and over 40 million underinsured. So what is it that you think that we as Americans can do?
Well, it's not really a question I can answer from this distance. I think that Bernard, it's been central to his politics since he started, from the day one, and really before that. It's always been part of it. He's always understood the need, and he's always fought for it. So like in many other things, I would take my lead from Bernard. Bernard is 100% in favor of Medicare for all. We have talked about whether the difference between Medicare for all and a national health service is that the vast majority of the actual treatment is provided by employees of the state, by it's complicated, and I won't go into the complexities, but they're basically employees of the state, and in Medicare for All, they're paid for by the state, but they're employed frequently. Some of them are employees of the state, like the Veterans Administration and so on, but most of them are employed by private companies, and that is a problem because it leaks money. But it's much less of a problem than the situation you've got. So I think Biden is wrong. He's on the wrong track. Where it comes from and why that history is there, I haven't examined closely enough. But it is a mistake.
Yeah. Do you think that Bernard will be reintroducing his Medicare for All bill?
I don't know the detail of it. He certainly has never given up for a second that being sent to his political work. But whether or not he'll do it, I don't know.
So what is next for the NHS? Being there are corporations, and from what I understand, the US is actually, part of the problem. What is next for it? Are people genuinely scared in the UK that they are going to lose their health care?
Well, we won't lose it entirely, but it's being nibbled. So I'll start with a positive side to it. I'm very pleased that recently, a couple of months ago, I proposed a motion to the Green Party of England and Wales, of which I'm a member, that we have a social care system that is all the services that people with disabilities and the people who help them need. At the moment, that is not like the NHS. That is not free of charge. It is means tested. If you're very poor, you will get the services free. If you're not very poor, you will not. It's a very ineffective system, and it's gotten much worse, and it's proved a disaster within the pandemic. So we passed a motion that called for a number of things, but the central one is that social care. I think in the U.S. people call it long-term care more often. So it's also nursing homes, but it's also care in your own home. If you've got Alzheimer's, if you're learning disabled, if you've got a mental health problem, if you've got multiple sclerosis, almost anything that makes it harder for you to do things, then you need help, and just like the health service, it is better if it's a free service. Free means that instead of people paying when they're ill and they can't do things and life is very difficult, the services are paid for by people who have the means to pay. It's not free in any other sense, but it is better for people with lots of money to be adequately and fairly taxed so that the services can be provided, so that the people working in the service can use their energies and their brains to do the things they think are necessary for people, with people, rather than worrying whether they're going to get paid. So that we've passed that, and to make sure the other side of it is having the money to make the services available is vital. But you also have the services have to be delivered in a certain way. People have to have rights. You can't just be treated high. There are doctors who are paid nicely who don't do their job well, who are offhanded and high hat and all the rest of that. And we know that. I think the vast majority are actually very good at it. And it's a lovely way to earn a living, to be able to help people without having to worry about your own finances. But people are entitled to be in charge of their own care. And that's another part of it. There's a very good United Nations Charter on Disabled People, Rights of Disabled People. And we've said that in our motion, which is now the policy of the party, is that we will pay, the services will be paid for like in the NHS, free at the point of use. And people within that will have specific rights guaranteed to them by the state to put them in charge of their own care. So I'm very pleased with that. We're trying to make it an issue in local elections at the moment. Unfortunately, the Labour Party, which under Corbyn had similar policies, not quite as good, but similar, has moved to the right, and they're not interested at the moment. I think that's a good opportunity for us to win some votes, And I hope it presses the very many very good people in the Labour Party to be stronger in working against their own leadership. So that's something good. And I think it's a principle. Instead of always being on the defensive, worried about what's going to come down the line that's going to make things worse, I think we need to go on the offensive and say, actually, we want a better system. We want more. We want a better life for everybody. All the things that people like you and like Bernard fight for all the time. But the other side of it is what you are hinting at, and not more than hinting. Things are getting worse. There's a bill that's going through Parliament at the moment, and since the government has a big majority, they will in the end pass it. Although I think there've been a couple of amendments that made it less horrible. But basically, it divides up the NHS quite cleverly, because it's very hard to sell off a system that providing care for 60 million people. It's a vast, multi-hundreds of billions. I can't remember how much money, a lot of money. So you can't, but if you chop it up into pieces, and they're proposing, I think, 42 or 44 local bits, then it becomes easier. And they have systems built into it where some of the providers will be private. If you're providing a service, whether you're an NHS provider or a private provider, you'll have a seat on the board. You'll have a decision-making proposal.
Absolutely. I just have one more question. As far as environmentally, in 2019, the UK did declare a climate emergency, as some of the countries did. Granted, some people think it's just, posturing, it's just words. But we haven't even done as much as that in the US. Are you noticing effects of people health-wise in the UK as far as water, pollution, anything like that?
Yeah. Well, the current government, anything they do or say is on the feeble side. They may not be as bad as the American government, but they're not good. As far as pollution goes, it has been a serious problem here, and more serious in some places than others. Traffic pollution, yes, and all the usual symptoms, the flooding we've had droughts. So all the things that are happening to the world because of the climate disaster are happening here. I don't think the British have as much in the way of a denial thing, but politically it remains a problem. Anything that's going to take money from people who don't want to use their money, corporations and so on, they fight every inch of the way, even when they say, mildly encouraging things. So yes, I mean, I don't know where we stand internationally. We're probably in the middle, not terribly good, not the worst, but basically nobody has grasped the nettle. Yes, if we don't switch, and it's quite ironic that part of the horror with the Ukraine at the moment is that we're sending huge amounts of money to the Russians for their gas and oil. If we had built the renewables, to turbines and the solar panels and the rest of it, we wouldn't need that. It's so pathetic that we're spending money not just with the Russians, but with the Saudis and with fracking and all the rest of that. When the sane thing, the cheap thing, the safe thing is to have renewable energy, which we could have done, and we can still do it. But every year we waste. I've been in the Green Party for over 20 years, and for the first, I didn't know a lot about environmental stuff at that point, and I learned in the first few months, and all the evidence was clear then. If we started then to shift energy and to insulate houses and all the simple things that need to be done, most of the disaster we're facing wouldn't be needed, and it would have been quite cheap. So it's very sad to see, and most of it was done in order to make some people some extra profit.
Absolutely.
So there are consequences to having bad people running your government.
Definitely. And we're seeing money is pretty much the cause of everything that is suffering in every category. And, you know, Bernard woke us up to that. I'm telling you, he gave us a free education as far as that went.
Yeah.
Is there anything you would like to add before we end the interview?
Oh, not really. You've asked me some very good questions. You saw the NHS in operation in the middle of it, which not everybody gets to see. And it's been a pleasure to talk to you and to hear from you over the years. Thank you very much.
Thank you so much, Uncle Larry. And we send our love to you, your brother, and all the fellow UK citizens who fight for us and speak their mind that we need better healthcare. So much love, and always great to hear from you.
Thank you so much.
Take care. Bye-bye.